Good morning. Thank you all for coming. We're really excited to have you at Scarborough Rouge Hospital's Birchmount site. I'd like to introduce the President and CEO of the hospital, Elizabeth Buller.
Good morning, everyone, and thanks for joining us here today. I am Elizabeth Buller, the President and CEO of the Scarborough and Rouge Hospital. And on behalf of our Board of Directors and our senior leadership team, I want to thank Minister Hoskins, Ontario's Minister of Health, and Sue Wong, MPP for Scarborough Agincourt, and Minister Mitzi Hunter, Minister of Education, for joining us today for this very special announcement here at Scarborough and Rouge Hospital. I'd also like to acknowledge a number of other very special guests who have joined us this morning. Again, Mitzi Hunter, Minister of Education, Toronto Mayor John Tory, Norm Kelly, Toronto Councillor for Ward 40, Scarborough Agincourt, Chin Lee, Toronto Councillor for Ward 41, Scarborough Rouge River. We also have some of our board members with us today. Vice Chair Terry McKinnon, Fred Clifford, Matt Ainley, Ome Jamal, and Gary Mackay. From the Toronto Central East Lynn, we have Deborah Hammonds and board member Amaral Saunders-Nadeau. We also have Dr. Michael Sherrar, President and CEO of the Cancer Care Ontario, leading Ontario Renal Network. We have Mr. Medhat Mahdi, President and CEO of the YMCA of Greater Toronto. We also have Dr. Paul Tam, our Chief of Nephrology here for Scarborough and Rouge Hospital. Dr. Catherine Whiteside, the second Vice Chair on the Scarborough and Rouge Hospital Board of Directors Foundation Board. And I'd be remiss to not give a very special thank you to Lai Chu and Pat Sherman and all of the community members who are here today to celebrate this special announcement. We're looking forward to working with each and every one of you as we continue to move this project forward. And now I have the pleasure of introducing a very strong advocate for the Scarborough and Rouge Hospital, Minister Mitzi Hunter, Minister of Education. Thank you.
Thank you. Thank you, Liz, and it's my pleasure to officially welcome you as the new head of the Scarborough and Rouge Hospital. It's really wonderful that you're here and leading at such an exciting time in a moment for the hospital and for healthcare in Scarborough. So I'm Mitzi Hunter, I'm Minister of Education, but I am the MPP for Scarborough-Guildwood, and I'm really thrilled to be here to be part of this wonderful announcement and to join my friend Sue Wong in sharing this news with you. Scarborough is a special community. We all know that. We have people who live here who have come from all over the world, and it really makes our community vibrant and a thriving place. Healthcare is a very important aspect of our community. It's something that I hear from my constituents. That's actually one of the things that makes our community very special. So I want to say thank you to all of the healthcare providers who are here today. I want to thank you for your service and for your commitment to the people of Scarborough. I know how hard you work, and not always under the best conditions. So thank you so much for the work that you do. I want to tell you a personal story because we're here to talk about the chronic kidney program. And my uncle was part of this program at the Scarborough General Hospital. And I remember on I think it was nursing week, I went to tour the hospital. He didn't know I was doing that. I was just doing this part of my job as an MPP. And going into that unit and seeing the lineups and seeing how the community really relied on that service and that support. So I quietly mentioned to one of the nurses, my uncle, he comes to this program, and do you guys know him? They're like, of course we know him. And, they were so personal. They knew his story, and they just took such good care of him until his very last. So this is this program and the investments that we're making is really important to the people of this community. It's important because there is a high need for this service in the community, and the investments that you're going to be making. And Minister Hoskins, thank you for coming out to Scarborough. Thank you for prioritizing the programs that we are doing here in this community, and it's great to have you here. However, we have a voice that no one can really deny in Scarborough that has been fighting for this program since day one. And that's my colleague, Sue Wong. Sue, you have been an incredible advocate and an incredible champion of this program. And look around you. You've brought the whole community together in celebration of this announcement. So congratulations. You've done an outstanding job. Without your advocacy, this could not have happened. So congratulations. And over to you.
Thank you very much, Missy. I'm so pleased that you'll be able to join us today. You know, this is Wednesday before the long weekend. You know where people are, should be. So I'm very pleased to be here. But before I introduce the minister, I'd like to provide some historical context to this morning's announcement. You know, you live long enough, you have the history, right? Today's announcement began about 8 years ago when I was still the Toronto District School Board trustee. So I'm not going to go through the history lessons with you, but I want to, like Mitzi, to thank the people who have been the initial community partners. Maddie from YMCA, thank you for perseverance and determination, because we need partners like yourself at YMCA. The two determined local residents, and I think, Liz, you mentioned them, Lai Chu and Pat Sherman, you know who you are. Thank you for making us honest, okay? That's what residents are all about. It's about keeping us in checks. And I'm going to have to acknowledge Councillor Kelly. Remember those phone calls? Those yo texts, okay? If you haven't seen them, you know who they are, okay? Mark Toohey, the former Chief of Staff for Mayor Ford, and the former Mayor Rob Ford, for their commitment to this initiative, because this initiative is like no others. It's a one-of-a-kind initiative when we roll this out. I also want to recognize the other community partners like Councillor Chin Lee. Where is he? I saw him right there, okay. Other ones, Agincourt Community Services, where's Lee Soda? Lee, I know you're tiny, but you're strong. Hong Fook, Bonnie from Hong Fook. Care First, Helen's here. Senior Person Living Connected, formerly the St. Paul's Senior Centers, who have worked very hard the last 5 years to get where we are today. And finally, I want to thank the staff, Minister. It wouldn't be where you are, all the three of us at Queen's Park with our staffs, right? So let me begin by acknowledging, where's Mark Tishman? Mark? The daily phone call, hourly phone calls, and the emails, and the Capital Branch staff that were in this for the last, especially the last 5 years, the last year and a half, I should say, and collaborating professionally with our communities, even those difficult moments, because this is really, really important to all of us. Now, I'm supposed to introduce the minister. All of us in this room knows Minister Hoskin. He doesn't really need an introduction. His distinguished career, no, you're not going, okay? His distinguished career as a physician, as a humanitarian before entering politics. This is how I'm going to introduce the minister today. I'm going to share a story about the minister. Last spring, this is about May, minister, remember that? The best time for those of you who want to advocate for any attention for the minister is after question period. Don't do it before, because they don't want to talk to you, okay, because opposition is going to get at them. After question period, I confronted the minister about this expanded center. So he listened, and I go, okay. And he goes, what are other challenges? Like, you don't want to know. I said, there are too many. So I asked him two questions. What does it take to secure the funding for this new center that we all have envisioned now hitting 7 years? And can you please send me the best people at the ministry who have the authority to make decision? Because I don't want somebody who's just going to pass paper around to me and say, okay, it can't be done, okay? So immediately after that, the minister instructed his staff at the Capital Branch to work with me and personally told me, I'm going to quote, this is what you said, Minister, I'm not sure you remember it, quote, we will get it done, end of quote. So, Minister, I want to personally thank you on behalf of all the residents in Scarborough, Durham Region, Markham, and beyond, for your commitment and advocacy work, what we're trying to do, to bringing care closest to the community, but more importantly, to the families. So, ladies and gentlemen, please bring your hand together to welcome Minister Hoskin.
what a great start already. I mean, these two speakers, John, we're in trouble because there's nothing we can say that's going to come close to the enthusiasm and the compassion and commitment that's already been expressed by my two predecessors and dear colleagues. And I had, Mitzi had her own personal story. I don't have a patient or a healthcare professional story. I was, to be honest, really kind of hoping we were going to be at the general site this morning, and I'll tell you why. Because I was talking to my wife, who was born at the general, and but she had a great story where she was a candy striper at Scarborough General, and she was a spit girl. Anybody know what that is? So, you know the paper bags that on some wards where they attach it to the rail of the bed, and people, they might have a chest infection or they need somewhere to spit, and so they have these envelopes. It's kind of like on an airplane, right? And so her job was to go around and put into place each day the paper bags that people could use during hospitalization. And then the worst part of that job was at the end of the day, she had to go around and collect the bags and replace them with a new one, right? So she was a spit girl. But I have to tell you that Sue Wong wins the award. There is absolutely nobody, politician or other person, that I've encountered in 3 years as Minister of Health who has been so relentless and committed to this project. It feels like every single day. Mark, where's Mark Tishman? Mark Tishman, who is, I think, secretly a full-time dedicated Sue Wong policy advisor who happens to reside in my office in the Ministry of Health, that has, this is the greatest day in Mark's entire life. Because I have, and, but it speaks to, because I think you two communicate via telepathy probably now. They've had so many conversations, but it is a reflection, I think, of what is so necessary for critically important community projects like this. But it speaks to Sue's dedication to the residents that she is responsible for providing that political leadership and driving important, vitally important community initiatives. So Sue, you win the award, and you're right, like question period, I sort of go in, I love the give and take, you know, and having no time to prepare yourself to answer whatever question the opposition might bring to you. But then and often during, but certainly immediately after question period, I'm a little bit anxious because I know I'm going to get a flood of people coming to me asking about projects in their riding. But there is no one, Mitzi, and I think you'll appreciate this as well, that has invested at Queen's Park more for her community than Sue and this project. And so the last thing that, and I know that many people have already been acknowledged this morning as well. I want to acknowledge that Michael Schurer, who is the head of Cancer Care Ontario, is here with us as well. And Cancer Care Ontario also has the responsibility of delivering, coordinating, planning, delivering renal kidney services across this province, and they do an exceptional job in that, and that is Michael's responsibility to ensure that those services are provided and of the highest quality. And so his presence here and the leadership that he's demonstrated on this project, I wanted to acknowledge that too. And Paul Tam, who's head of, Paul, where are you? Head of nephrology. So, and others that have been mentioned, the Y, United Way, Agincourt Community Services, Hang Fook, Care First, and many others, community members as well, that have demonstrated remarkable leadership in what has been a many, many year process to get us here today. But it is exciting to be here today. And last, I want to thank our hosts, and Liz as well. How many weeks have you been in the job? 6.5. But, you know, we're both Mac grads, so we did our education at Mac, right? And Liz has demonstrated remarkable leadership in healthcare across this country but in Toronto as well. And you're so fortunate. I was absolutely elated and excited when I learned that Liz was being asked to take on the responsibility of President and CEO of Scarborough Rouge. And you're fortunate to have her, but you can have confidence that she, through this transformational period going forward, she is the right person for the job and is going to provide the leadership of a strong team already that will get the job done. So, and of course, we can't have an announcement that involves healthcare without thanking the many, many patients, staff, management, families, the hospital board, who I know is well represented here, for their dedication and their commitment to their patients and to healthcare every single day. Ladies and gentlemen, our hospitals truly are system leaders in supporting patients to manage chronic conditions in their community. And like the staff at the hospital who work tirelessly to help you, our government is committed to providing you with the high-quality care that you need. So it gives me great pleasure to announce today that our government is improving services for people in Scarborough with chronic kidney disease by expanding Scarborough and Rouge Hospital's chronic kidney disease program to be accommodated in a brand new, modern facility. That was kind of so I think the news must have leaked out already. That was a pause for effect, and thank you for the effect. But what it will mean is patients in Scarborough will have faster access to high-quality dialysis services within the community when this facility is complete. And the new facility will provide treatment to patients with chronic kidney disease by accommodating 45 dialysis stations. And of that, it will be 26 existing stations that will be reallocated from existing sites, but 19 new stations as well, for a total of 45 dialysis stations. And also, which is critically important, because more and more people are opting for home dialysis as well. And so the new facility will also accommodate 6 home hemodialysis stations that will be reallocated from the general site, and 3 new home hemodialysis stations that will be added to those 6 that are moving from the general. And so what this does is will increase access to training and support for patients who can and choose to receive dialysis at home. So if someone in Scarborough or the entire region is living with kidney disease, then access to the services you need in your community is going to get even easier, because we're investing in the construction of a new modern facility to provide the treatment that you need. And I wish I could tell you the actual dollar value. We sort of refrain, I'm just giving you an honest explanation, we kind of refrain, it is in the many tens of millions of dollars. We refrain from giving an exact number because we don't want to negatively impact the request for proposals. Imagine you don't want to tell potential bidders what we're prepared to pay, but I can reassure you that this is a it's in the multi-tens of millions of dollars, the investment on the capital side alone for this new facility. So our government is also providing a grant to help Scarborough and Rouge Hospital plan and construct this new facility. And it's part of our overall investment in hospital infrastructure that was referenced in the budget this year, which in fact is overall, it's a $20 billion investment commitment in hospital infrastructure over the next decade. So importantly, and I know others will speak to this, that the dialysis facility will, and this is, I think, the really exciting part of it, the dialysis facility will form part of a community hub, a health and wellness hub. It will enable many community partners, many of which are here with us today, to co-locate their health and wellness services alongside the community dialysis program in order to form a community hub, the Bridletown Hub. If there was any debate in terms of where it's going. So it may be, it may be a bit early for congratulations, but I want to express my thanks for all of the partners that have been at the table to pursue this project for many years. And first of all, as I've mentioned, a special thank you to MPP Sue Wong. Her tireless, relentless advocacy on behalf of her community. Without it, we wouldn't be here today. And I know there are many, many people that we could say with the same level of enthusiasm about their advocacy and commitment, but I want to single out Sue for that. Thank you for your important and hard work and for being here, of course, with us today. The City of Toronto. The City of Toronto, and I have to say, I have so enjoyed my relationship, friendship with Mayor Tory on a myriad of issues. Most recently, you might have heard us speak to the issue of opioid overdoses in Toronto and in the province, but on a whole host of issues. I want you to know that John has been an absolute, authentic champion and leader for the communities that comprise Toronto. And it's been, for me, it's been an absolute joy working with him and with his team and others like Norm to advance the cause of healthcare, to provide the highest quality care in often difficult and challenging circumstances. And the City of Toronto, it is I think a perfect example of a demonstration of that city leadership and the leadership of the individuals who are our elected officials. Because to give you the example of how the city has carefully protected and held on to the Bridletown land and had that, embraced that shared vision of its potential for a health and wellness hub, a hub that we're beginning to realize today. So I thank the city and the mayor for their commitment because as a result of their leadership, we are now one big step closer to achieving that overall vision of a community hub. And I can assure you that without strong commitments like the one that the City of Toronto has made, it is very challenging for providers to succeed. So I want to personally thank Mayor Tory and Councillor Kelly for your commitment to this project. So we're all doing this, all of us, whether we're healthcare providers or politicians, whether we're city councillors or provincial elected officials, community members, agencies that provide support and care. We're all doing this because we want to collectively ensure that this community and others like it have access to the right care in the right place at the right time. We're transforming our healthcare system into one that's going to be able to take care of your healthcare needs and your family for generations to come. So thank you all for joining us today. I look forward to hearing from others about this project, and most of all, I look forward to watching this project grow into a bright and successful program for the health and wellness services for this community. Thank you very much.
So thank you, Minister Hoskins, for that very, very exciting announcement, knowing we have one of the largest chronic kidney disease populations in North America, as I understand. And thank you for your ongoing commitment for Scarborough as we continue to move forward. It's now, I'd like to welcome another very strong friend of Scarborough's and someone who has been a huge advocate for this project. It's my honor to welcome our Mayor, John Tory.
Well, Liz and ministers and fellow elected representatives, ladies and gentlemen. First of all, just to carry on with the theme and provide, I guess, independent, objective confirmation, there are different categories of awards here for advocacy, and so I bring you the results of the awards from City Hall as to the provincial MPP who has been most diligent and determined and persistent to the point where there might have been days when you'd say pain in the neck. But having said all that, that means doing job effectively. Sue Wong wins at City Hall as well. And that is because, as has been mentioned, we are, and there's a long sort of convoluted history to this, but, you know, in the end, you don't care about a long convoluted history when you end up in the right place. But the city is the landlord. I mean, technically, it owns the piece of land where this wonderful and most important community hub. And of course, it's more than just the dialysis thing. And I say that not to minimize the incredible importance of this step forward today. There's going to be a partnership with the YMCA that's important, and many other people in addressing something that I've come to learn more and more about in the short time that I've had the job I've had. And that is somehow over time, Scarborough with 600,000 plus people came to be underserved. And I think it's because of the inherent decency of people who live in Scarborough, who didn't, you know, perhaps speak up to say, you know, we are underserved when it comes to transportation. And we're trying to fix that. You know how complex and difficult that is. But we're trying. When I say we're trying with the help and teamwork of our friends at the Government of Ontario and the Government of Canada to fix that. And we're doing the same with healthcare, and today is a part of that. And Sue was absolutely relentless in making sure that we at the city came along with the evolution of this project to allow us to be here today. Now that's from the representative outside of the City Hall, the representative inside the City Hall, who earns the same honor for being a relentless and determined person who raised it at City Council, who raised it with my office, repeatedly with me, was Councillor Norm Kelly. And again, that's not to diminish the support that came from Councillor Chin Lee and others, but Norm, again, was somebody who just took this, I think in part, I think they did co-conspire. I'm not sure. I never could prove that. But, you know, that's their job. But I just want you to know they did it effectively. And I want, when I say you, I'm just so happy to be here with the team of people who are the healthcare providers, professionals, and staff who do such a wonderful job in this hospital each and every day. You know, dialysis is not something that you can go without. And so it really is a matter in that case of making sure we can provide it conveniently, safely, in the most modern surroundings possible. And Mitzi and the Minister of Health spoke to that very convincingly this morning as to why this facility is so important. But the community hub that is to arise on that site is going to be much more than that, because there are other things less essential. You can't go without dialysis, you know, for the sake of your life and your health. But there are other community services, recreational services, and other things that communities within Scarborough have the right to have within reasonable proximity of where they live, that haven't been available to those people and to those communities in the past. And this step forward today is going to make sure that that happens. And we've got some distance to go in terms of making sure that the whole of the community hub is going to happen, but this is a wonderful start today. And people now will not have to drive or take transit or walk as far away as they're having to do today to access services, whether it be healthcare related or other community services that are fundamentally important to them having a fair chance to have a good life and to have a complete life for themselves and for their children. And so I just want to say thank you to the Government of Ontario for stepping forward today to take this huge step in establishing an important part of this community hub. And we are partners of it. We will continue to be partners of it. We will work with the YMCA and many others of the organizations that have been mentioned today that are going to be partners in this as well. And, you know, we have issues from time to time between governments. This is part of the natural ebb and flow of government and of all the difficult decisions. I was trying to explain to someone last night. In fact, I was even mentioning it just back here this morning where somebody said, well, we need more money. And I said, well, you know, the toughest part of these jobs that we have is that you are taking money from people's pockets and they need that money to pay their own bills. We need more money to provide public services, and you have to try to strike a balance. And so it is as between governments, where how they share money back and forth. So you'll see issues that come from time to time. But I'd rather look at today as a shining example of how we can work together effectively to make sure that areas that have been underserved or not as served as well as they should be in the 21st century are going to get better service, and with aspirations to do more in terms of this broader community hub that's going to be established. And so I just conclude by saying to you that I think you're seeing today the kind of cooperation you expect between and among at least two levels of government in today's case. And I want to say to the minister, I want to say through him and through the ministers, plural, but through them to the premier, to Sue, Thank you for being good partners for the City of Toronto. Thank you for being a great partner to Scarborough in addressing this most important need, and that I certainly am looking forward with Norm Kelly and Chin Lee and others to doing many more things together to serve the people that we all serve together in this important part of the city. Thank you very much.
Thank you, Mayor Torian, for your continued support as well. I'd now like to invite Ethel Doyle, who is a founding member of our nephrology program, to come forward and make a few remarks. She's also the administrative director, and will have a huge amount of time and investment in making this come to fruition. So, Ethel, turn it to you.
Good morning. Today is certainly an exciting day to hear the fantastic news that our dialysis resources, which is so needed within the Scarborough region, is going to expand and better meet the demand for life-sustaining treatment required by those living with kidney failure. Today's announcement is an acknowledgement that the hard work of so many has created a voice that has been heard. I reiterate the thanks extended today by our CEO and the dignitaries here today. I bring somewhat of a unique perspective on what this expansion means, not just to our hospital, but to our patients, their families, and to the community. I have not only had the honor and privilege to be one of the few working alongside in the beginning with Dr. Paul Tam, who started this nephrology program here at the Scarborough and Rouge Hospital back in September of 1996. I have also been witness over the years to this hospital providing excellent care, especially to our kidney patients, and working alongside the nephrology program in its development and growth. I've had the honor of leading a nephrology team dedicated and committed to teaching, educating, supporting, and caring for not just patients living with kidney disease, but to their families and loved ones too. And I have had the privilege and honor of receiving such services from this team, from this hospital, in enabling me and my brothers to provide dialysis care for my father at home, who are here today in supporting this wonderful announcement. This announcement today, in committing to a new facility, will better enable patients to receive holistic approach to healthy living and disease prevention, enable our patients, families, and loved ones to be empowered to be self-managers of their care, which will all have positive impact on our efforts to improve population health within our Scarborough region and hopefully decrease the prevalence of disease which causes kidney failure. The perspective I bring as a longtime administrator to this program and hospital, as a person who grew up in Scarborough, and a care provider to my father on dialysis, makes me forever grateful to so many who have worked to support this need. Thank you to all who have made this possible.
Thank you, Ethel, for your inspiring words and sharing your story. And thank you for your continued leadership with Dr. Paul Tam for our nephrology program. I'd now like to ask our Vice Chair of the Scarborough Rouge Hospital Board of Directors, Terry McKinnon, to come forward and say a few remarks.
Ladies and gentlemen, Scarborough and Rouge Hospital is proud to be home of one of the largest regional nephrology programs in North America. More than 6,000 patients receive care through our in-hospital unit, or one of our 3 satellite units. Our chronic disease program is an integral part of the services that we offer. It's one of 26 regional chronic disease programs in Ontario and one of 3 regional programs within the province. Patients in our chronic Disney program are cared for by an interdisciplinary team that provides them with a range of specialized services, including dialysis, as you heard. The focus is on educating and supporting our patients in order to maintain them in a state of wellness while living with chronic kidney disease. Sadly, the need for dialysis and these other services is growing faster than our ability to provide them. That's why we are so grateful to receive this investment from the Government of Ontario that will help us with the much-needed dialysis stations and continue to offer high quality of care close to home for our diverse community. So on behalf of the hospital's Board of Directors, I'd like to send my thanks to Minister Hoskins and our champion MPP, Sue Wong, for their incredible commitment to this urgent care in our community. Thank you.
Thank you, Terry. Before we close, I'd like to take this opportunity once again to thank everyone involved in today's announcement, in particular Minister Hoskins, Minister Hunter, and MPP Sue Wong, and Mayor Tory. Thank you so much for coming here today. This project is a true example of very bold leadership from the provincial government, and we thank you for that, as well as the tireless dedication and commitment from our community and our community partners. Thank you. This announcement is also, as Mayor Tory mentioned, an incredible example of how when the province and the city come together, we can create exceptional care for the patients and families in our community. So thank you for that opportunity as well. I look forward to working with everyone to make this come to a realization, and we'll thank you all for being here today. And the minister has agreed to take questions to the side after we close. Thank you again for your time and your commitment to Scarborough and Rouge Hospital and our patients.